Welcome to the CCRN Mastery, the ultimate study guide for adult critical care nurses. Whether you're striving to elevate your nursing expertise, expand your career opportunities, or achieve your CCRN certification, you've come to the right place. This video is designed to guide you through the core concepts of critical care nursing, offering real-world scenarios, practical strategies, and key insights to help you excel. After each chapter, you'll find a dedicated Q&A session to reinforce your learning. For comprehensive preparation, check the description for access to the Audible version, the free Ultimate Exam Prep Guide, or the Amazon link for the book. Don't forget to like and subscribe for more updates and practice content. Now, let's begin this journey towards CCRN success with your instructor.
Number 1. What is the primary goal of palliative care in critical care settings? A. To cure the underlying disease. B. To provide relief from symptoms and stress of illness. C. To facilitate high-intensity treatments. Or D. To conduct research on critical illnesses. The answer is B. To provide relief from symptoms and stress of the illness. Number 2. Which intervention is the most effective for preventing ventilator-associated pneumonia, VAP? A. Routine antibiotic administration. B. Elevating the head of the bed to 30 to 45 degrees. C. Frequent change of ventilator circuits. Or D. Using non-invasive ventilation. The answer is B. Elevating the head of the bed to 30 to 45 degrees. Number 3. In pain management for critically ill patient, which assessment tool is commonly used? A. Numeric Rating Scale, NRS. B. Glasgow Coma Scale, GCS. C. Apache 2. Or D. Braden Scale for predicting pressure to sore risk. The answer is A. Numeric Rating Scale, NRS. Number 4. What is the key component of family-centered care in a critical care unit? A. Restricting visiting hours to ensure patient rest. B. Encouraging family participation in care decisions. C. Limiting family discussions to medical information only. Or D. Discouraging personalization of the patient's space. The answer is B. Encouraging family participation in care decisions. Number 5. Which is a core principle of ethical care in critical care nursing? A. Beneficence. B. Financial efficiency. C. Minimal involvement. Or D. Legal priority. The answer is A. Beneficence. Number 6. When considering end-of-life care, what is the nurse's role in advanced care planning? A. Making decisions on behalf of the patient. B. Providing information and support to patients and families. C. Ignoring patients' preferences in favor of medical advice. Or D. Focusing solely on physical symptoms. The answer is B. Providing information and support to patients and families. Number 7. In managing a patient's nutrition in the ICU, what is a critical factor? A. Administering parenteral nutrition early. B. Prioritizing carbohydrate intake. C. Early enteral feeding. Or D. High-fat diets. The answer is C. Early enteral feeding. Number 8. What is the first step in effective pain management for a critically ill patient? A. Administering analgesics regularly. B. Accurate pain assessment. C. Patient sedation. Or D. Implementing non-pharmacological interventions. The answer is B. Accurate pain assessment. Number 9. For a patient with acute respiratory distress syndrome, ARDS, which position is recommended to improve oxygenation? A. Supine position. B. Prone position. C. Sitting upright. Or D. Lateral position. The answer is B. Prone position. Number 10. What is the most important aspect of communication with a critically ill patient's family? A. Providing medical details only. B. Ensuring brief communication. C. Offering clear, compassionate, and honest information. Or D. Avoiding discussions about prognosis. The answer is C. Offering clear, compassionate, and honest information. Number 11. Which technique is most effective for reducing the risk of catheter-associated urinary tract infection, CAUTI, in critical care? A. Frequent catheter replacement. B. Using coated catheters. C. Maintaining a closed drainage system. Or D. High fluid intake to increase urine output. The answer is C. Maintaining a closed drainage system. Number 12. What is the most important factor in preventing pressure ulcers in critically ill patients? A. Regular repositioning. B. Using high-density foam mattresses. C. Topical skincare products. Or D. Nutritional supplements. The answer is A. Regular repositioning. Number 13. In critical care settings, what is the primary concern when providing care for a mechanically ventilated patient? A. Ensuring patient comfort. B. Minimizing sedation. C. Preventing ventilator dependency. Or D. Frequent oral care. The answer is D. Frequent oral care. Number 14. What is the cornerstone of effective delirium management in ICU patients? A. High-dose antipsychotic medications. B. Early mobilization and physical therapy. C. Continuous sedation. Or D. Restraining the patient. The answer is B. Early mobilization and physical therapy. Number 15. Which strategy is key in preventing ICU-acquired weakness? A. Prolonged bed rest. B. High-dose corticosteroids. C. Early physical and occupational therapy. Or D. Strict immobilization. The answer is C. Early physical and occupational therapy. Number 16. How is sepsis most effectively managed in critical care? A. Immediate broad-spectrum antibiotics. B. Delayed fluid resuscitation. C. Limited diagnostic testing. Or D. Exclusive use of vasopressors. The answer is A. Immediate broad-spectrum antibiotics. Number 17. Which intervention is crucial in the care of a patient with acute kidney injury, AKI, in the ICU? A. Aggressive diuretic therapy. B. Maintaining fluid balance and monitoring output. C. High-protein diet. Or D. Restricting all medications. The answer is B. Maintaining fluid balance and monitoring output. Number 18. What is the main objective in the management of a patient with ARDS? A. Maximizing oxygen delivery. B. Minimizing fluid intake. C. Lung protective ventilation strategies. Or D. High tidal volume ventilation. The answer is C. Lung protective ventilation strategies. Number 19. In managing a critically ill patient with septic shock, which fluid is preferred for initial resuscitation? A. Colloids. B. Hypertonic saline. C. Crystalloids. Or D. Albumin solutions. The answer is C. Crystalloids. Number 20. Which assessment is critical for patients with traumatic brain injury, TBI, in the ICU? A. Glasgow Coma Scale, GCS. B. Braden Scale for predicting pressure sore risk. C. Apache 2. Or D. Numeric Rating Scale, NRS. The answer is A. Glasgow Coma Scale, GCS. Number 21. What is the primary focus in the initial treatment of a burn patient in the ICU? A. Skin grafting. B. Fluid resuscitation. C. Early ambulation. Or D. Scar management. The answer is B. fluid resuscitation. Number 22. Which is an essential component of managing patients with acute coronary syndrome, ACS, in the ICU? A. Immediate PCI, percutaneous coronary intervention. B. Delayed stress testing. C. Routine use of anticoagulants. Or D. Long-term bed rest. The answer is A. Immediate PCI, percutaneous coronary intervention. Number 23. For patients in the ICU, which method is most effective for reducing the risk of deep vein thrombosis, DVT? A. Extended bed rest. B. Pharmacological prophylaxis. C. Application of heat to extremities. Or D. Reduced fluid intake. The answer is B. Pharmacological prophylaxis. Number 24. In managing a post-operative patient in the ICU, what is crucial for preventing post-operative ileus? A. Prolonged fasting. B. Immediate high-fiber diet. C. Early mobilization and gradual oral intake. Or D. Continuous nasogastric suction. The answer is C. Early mobilization and gradual oral intake. Number 25. What is the primary rationale for using non-invasive ventilation, NIV, in the ICU? A. To reduce the need for intubation. B. To increase sedation requirements. C. As a permanent alternative to invasive ventilation. Or D. Only for patients with chronic obstructive pulmonary disease, COPD. The answer is A. To reduce the need for intubation. Number 26. In a critically ill patient with diabetes, what is key to managing their glycemic control? A. Maintaining blood sugar levels below 110 milligrams per deciliter. B. Avoiding blood sugar monitoring. C. Ensuring tight glycemic control. Or D. Periodic insulin administration. The answer is C. Ensuring tight glycemic control. Number 27. Which approach is most appropriate for pain assessment in a nonverbal critically ill patient? A. Assuming the absence of pain. B. Use of objective pain assessment tools. C. Infrequent assessment. Or D. Sole reliance on vital signs. The answer is B. Use of objective pain assessment tools. Number 28. What is a priority in the management of a patient with acute liver failure in the ICU? A. Immediate liver transplantation. B. Management of cerebral edema. C. Restricting all medication use. Or D. High-protein diet. The answer is B. Management of cerebral edema. Number 29. Which is a fundamental aspect of care for a patient experiencing acute respiratory failure? A. Minimize oxygen use. B. Providing ventilatory support. C. Limiting fluid intake strictly. Or D. Immediate tracheostomy. The answer is B. Providing ventilatory support. Number 30. In the critical care of a patient with acute pancreatitis, what is the key treatment strategy? A. Early endoscopic intervention. B. Aggressive feeding. C. Pain management and fluid resuscitation. Or D. Immediate surgical intervention. The answer is C. Pain management and fluid resuscitation. Number 31. What is the recommended target mean arterial pressure, MAP, for most critically ill patients? A. 60 to 65 millimeters of mercury. B. 70 to 75 millimeters of mercury. C. 80 to 85 millimeters mercury. Or D. 90 to 95 millimeters of mercury. The answer is A. 60 to 65 millimeters mercury. Number 32. In managing a patient with acute respiratory failure, what is the primary goal of non-invasive ventilation, NIV? A. To improve oxygenation. B. To provide rest to respiratory muscles. C. To avoid intubation. Or D. to decrease carbon dioxide levels? The answer is C, to avoid intubation. Number 33. Which is a key indicator of fluid overload in a patient with acute heart failure? A. Tachycardia. B. Hypotension. C. Jugular venous distension. Or D. Bradycardia. The answer is C. Jugular venous distension. Number 34. What is the most effective initial treatment for a patient experiencing anaphylactic shock? A. High-dose corticosteroids. B. Intravenous fluids. C. Epinephrine. Or D. Antihistamines. The answer is C. Epinephrine. Number 35. Which lab test is most indicative of coagulopathy in a critically ill patient? A. Complete blood count, CBC. B. Prothrombin time, PT. C. Blood urea nitrogen, BUN. Or D. Liver function tests, LFTS. The answer is B. Prothrombin time, PT. Number 36. In a patient with severe sepsis, what is the primary reason for administering broad-spectrum antibiotics? A. To prevent secondary infections. B. To treat the most likely pathogens. C. To reduce fever. Or D. To improve white cell count. The answer is B. To treat the most likely pathogens. Number 37. What is the most common side effect of mechanical ventilation? A. Pulmonary embolism. B. Barotrauma. C. Thrombocytopenia. Or D. Ventilator-associated lung injury. The answer is D. Ventilator-associated lung injury. Number 38. For a patient with acute renal failure, which parameter is most crucial for dialysis initiation? A. Urine output. B. Serum creatinine. C. Fluid overload. Or D. Blood pressure. The answer is C. Fluid overload. Number 39. What is the primary goal of nutritional support in critically ill patients? A. To prevent weight loss. B. To maintain muscle mass. C. To provide adequate caloric intake. Or D. To improve wound healing. The answer is C. To provide adequate caloric intake. Number 40. In a patient with suspected bacterial meningitis, what is the priority nursing action? A. Administer antipyretics. B. Initiate antibiotic therapy. C. Perform lumbar puncture. Or D. Provide analgesics. The answer is B. Initiate antibiotic therapy. Number 41. Which sign indicates early hypovolemia in a trauma patient? A. Decreased capillary refill. B. Hypertension. C. Tachypnea. D. Tachycardia. The answer is D. Tachycardia. Number 42. What is the most effective strategy for preventing catheter-associated urinary tract infections, CAUTIs, in the ICU? A. Routine catheter changes. B. Antibiotic prophylaxis. C. Aseptic insertion and maintenance. Or D. Frequent urinary analysis. The answer is C. Aseptic insertion and maintenance. Number 43. For a patient with acute stroke, what is the primary goal of early intervention? A. To prevent a recurrent stroke. B. To restore blood flow to the affected area. C. To control blood pressure. Or D. To reduce cerebral edema. The answer is B. To restore blood flow to the affected area. Number 44. Which assessment is crucial for a patient with suspected tension pneumothorax? A. Auscultation of breath sounds. B. Chest X-ray. C. Arterial blood gas analysis. Or D. Echocardiogram. The answer is A. Auscultation of breath sounds. Number 45. What is the primary concern in the management of a patient with a massive hemoptysis? A. Airway protection. B. Fluid resuscitation. C. Blood transfusion. Or D. bronchial artery embolization? The answer is A, airway protection. Number 46. In a patient with suspected gastrointestinal bleed, what is the initial diagnostic procedure? A, endoscopy, B, abdominal CT scan, C, complete blood count, CBC, or D, stool occult blood test? The answer is A, endoscopy. Number 47. What is the most common cause of hypoxemia in critically ill patients? A, pulmonary embolism, B, atelectasis, C, pneumonia, or D, ARDS? The answer is B, atelectasis. Number 48. What is the primary intervention for a patient experiencing acute ventricular tachycardia, VT, with a pulse? A, immediate defibrillation, B, antiarrhythmic medication, C, synchronized cardioversion, or D, pacemaker insertion? The answer is C, synchronized cardioversion. Number 49. Which parameter is most important in assessing a patient with suspected cardiogenic shock? A, blood pressure, B, heart rate, C, cardiac output, D, peripheral perfusion? The answer is C, cardiac output. Number 50. In managing a patient with subarachnoid hemorrhage, what is the primary goal to prevent secondary injury? A, control of hypertension, B, maintenance of normothermia, C, seizure prophylaxis, or D, cerebral perfusion pressure management? The answer is D, cerebral perfusion pressure management. Number 51. In a patient with acute liver failure, what is the primary treatment for managing increased intracranial pressure? A, mannitol administration, B, high-dose corticosteroids, C, hyperventilation therapy, or D, barbiturate coma induction? The answer is A, mannitol administration. Number 52. What is the first-line pharmacological treatment for acute pulmonary edema? A, beta blockers, B, diuretics, C, ACE inhibitors, or D, calcium channel blockers? The answer is B, diuretics. Number 53. Which is the most appropriate initial fluid choice for resuscitation in septic shock? A, 0.9% saline, B, 5% dextrose, C, albumin solution, or D, lactated ringer solution? The answer is A, 0.9% saline. Number 54. For a patient with a suspected myocardial infarction, what is the significance of ST segment elevation on an ECG? A, indicates a non-ST elevation myocardial infarction, NSTMI. B, is a normal variant. C, suggests myocardial ischemia. Or D, indicates an ST elevation myocardial infarction, STMI. Answer is D, indicates an ST elevation myocardial infarction, STMI. Number 55. In a patient with acute respiratory distress syndrome, ARDS, what is the rationale for using a lung protective ventilation strategy? A, to reduce the risk of barotrauma, B, to increase oxygenation, C, to facilitate weaning from mechanical ventilation, or D, to improve carbon dioxide elimination? The answer is A, to reduce the risk of barotrauma. Number 56. What is the primary management goal for a patient with an acute ischemic stroke and elevated blood pressure? A, rapid blood pressure reduction to normal range, B, gradual lowering of blood pressure, C, immediate antihypertensive therapy, or D, maintenance of slightly elevated blood pressure? The answer is B, gradual lowering of blood pressure. Number 57. What is the most common initial symptom of deep vein thrombosis, DVT, in critically ill patients? A, redness and warmth at the site. B, sudden onset of chest pain. C, swelling of the affected limb. Or D, fever? The answer is C, swelling of the affected limb. Number 58. In a patient with severe sepsis, What is the significance of lactate clearance? A. Indicates renal failure. B. Suggests effective resuscitation. C. Signifies liver dysfunction. Or D. Implies ongoing hypoperfusion. The answer is B. Suggests effective resuscitation. Number 59. Which imaging modality is most effective in diagnosing an acute intracerebral hemorrhage? A. MRI. B. CT scan. C. Ultrasound. Or D. X-ray. The answer is B. CT scan. Number 60. What is the primary goal of sedation in mechanically ventilated patients? A. To facilitate patient ventilator synchrony. B. To provide pain relief. C. To reduce anxiety. Or D. To induce amnesia. The answer is A. To facilitate patient ventilator synchrony. Number 61. In a patient with acute renal failure, what is the key indicator for initiating renal replacement therapy? A. Hyperkalemia. B. Anuria. C. Hypotension. Or D. Uremia. The answer is D. Uremia. Number 62. What is the primary treatment for a patient with tension pneumothorax? A. Oxygen therapy. B. Chest tube insertion. C. Needle decompression. Or D. Mechanical ventilation. The answer is C. Needle decompression. Number 63. Which medication is most effective for rate control in a patient with atrial fibrillation and rapid ventricular response? A. Digoxin. B. Amiodarone. C. Beta blockers. Or D. Calcium channel blockers. The answer is C. Beta blockers. Number 64. In a patient with septic shock, what is the primary goal of fluid resuscitation? A. To increase urine output. B. To restore intravascular volume. C. To improve skin turgor. Or D. To elevate blood pressure. The answer is B. To restore intravascular volume. Number 65. What is the most common cause of a nosocomial infection in the ICU? A. Central line associated bloodstream infections. B. Surgical site infections. C. Ventilator associated pneumonia. Or D. Catheter associated urinary tract infections. The answer is C. Ventilator associated pneumonia. Number 66. In a patient with a suspected upper gastrointestinal bleed, which clinical sign is most indicative of significant blood loss? A. Hematemesis. B. Melena. C. Hypotension. Or D. Tachycardia. The answer is A. Hematemesis. Number 67. What is the primary purpose of using inotropic agents in heart failure patients? A. To reduce preload. B. To increase cardiac contractility. C. To decrease afterload. Or D. To control heart rate. The answer is B. To increase cardiac contractility. Number 68. Which clinical manifestation is most indicative of neurogenic shock in a patient with spinal cord injury? A. Tachycardia. B. Hypotension. C. Hyperthermia. D. Hypertension. The answer is B. Hypotension. Number 69. What is the primary goal in management of a patient with acute asthma exacerbation in the ICU? A. To reduce airway inflammation. B. To prevent respiratory failure. C. To decrease airway hyperresponsiveness. Or D. To normalize peak flow rates. The answer is B. To prevent respiratory failure. Number 70. In the management of a critically ill patient with hyperglycemia, what is the most important factor to avoid? A. Hypoglycemia. B. Diabetic ketoacidosis. C. Osmotic diuresis. Or D. Glycemic variability. The answer is A. Hypoglycemia. Number 71. In the management of acute respiratory distress syndrome, ARDS, what is the importance of maintaining a lower tidal volume? A. To reduce the risk of ventilator-associated pneumonia. B. To prevent alveolar overdistension and barotrauma. C. To increase oxygenation efficiency. Or D. To facilitate easier weaning from mechanical ventilation. The answer is B. To prevent alveolar overdistension and barotrauma. Number 72. What is the primary indication for using hypertonic saline in a patient with traumatic brain injury, TBI? A. To correct hyponatremia. B. To reduce intracranial pressure. C. To improve cerebral perfusion. Or D. To manage seizures. The answer is B. To reduce intracranial pressure. Number 73. In a patient with septic shock, what is the primary reason for administering vasopressor agents? A. To improve cardiac output. B. To decrease heart rate. C. To maintain adequate mean arterial pressure. Or D. To reduce systemic vascular resistance. The answer is C. To maintain adequate mean arterial pressure. Number 74. What is the most common complication associated with acute pancreatitis in critically ill patients? A. Diabetes mellitus. B. Pseudocyst formation. C. Pancreatic necrosis. Or D. Ascites. The answer is C. Pancreatic necrosis. Number 75. In the management of a patient with acute myocardial infarction, AMI, what is the main benefit of early reperfusion therapy? A. To relieve chest pain. B. To reduce the risk of arrhythmias. C. To limit myocardial infarct size. Or D. To lower blood pressure. The answer is C. To limit myocardial infarct size. Number 76. What is the primary objective of using early goal-directed therapy in the treatment of septic shock? A. To enhance oxygen delivery to tissues. B. To rapidly administer antibiotics. C. To normalize lactate levels. Or D. To achieve early hemodynamic stabilization. The answer is D. To achieve early hemodynamic stabilization. Number 77. For a patient with acute upper gastrointestinal bleeding, what is the significance of a dropping hemoglobin level and stable vital signs? A. Indicates immediate need for surgery. B. Suggests a slow ongoing bleed. C. Implies rapid and severe blood loss. Or D. Indicates potential resuscitative response. The answer is B. Suggests a slow ongoing bleed. Number 78. In a patient with acute respiratory failure, what is the significance of a PaO2/FiO2 ratio less than 200? A. Indicates mild ARDS. B. Suggests moderate ARDS. C. Indicates severe ARDS. Or D. Suggests impending respiratory failure. The answer is B. Suggests modern ARDS. Number 79. What is the primary consideration in the choice of antibiotics for a critically ill patient with pneumonia? A. Duration of therapy. B. Cost of medication. C. Antibiotic resistance patterns. D. Speed of bacterial action. The answer is C. Antibiotic resistance patterns. Number 80. In the management of a patient with a large pleural effusion, what is the primary reason for performing thoracentesis? A. To relieve dyspnea. B. To prevent infection. C. To diagnose the underlying cause. Or D. To improve oxygenation. The answer is C. To diagnose the underlying cause. Number 81. What is the primary goal of fluid management in a patient with acute kidney injury, AKI? A. To maintain euvolemia. B. To induce diuresis. C. To prevent hypotension. D. To reduce creatinine levels. The answer is A. To maintain euvolemia. Number 82. In a patient with a suspected subarachnoid hemorrhage, what is the significance of a positive Koenig sign? A. Indicates a herniated disc. B. Suggests meningeal irritation. C. Implies increased intracranial pressure. Or D. Indicates cerebral edema. The answer is B. Suggests meningeal irritation. Number 83. What is the primary reason for continuous monitoring of central venous pressure, CVP, in a patient with septic shock? A. To assess renal function. B. To evaluate left ventricular function. C. To guide fluid therapy. Or D. To monitor for pulmonary edema. The answer is C. To guide fluid therapy. Number 84. What is the most effective intervention for preventing ventilator-associated lung injury, VALI? A. High-frequency oscillatory ventilation. B. Prone positioning. C. Lung protective ventilation strategies. Or D. Regular bronchial hygiene. The answer is C. Lung protective ventilation strategies. Number 85. In the management of a patient with anaphylaxis, what is the rationale for administering antihistamines? A. To counteract hypotension. B. To prevent airway obstruction. C. To reduce bronchospasm. Or D. To alleviate itching and hives. The answer is D. To alleviate itching and hives. Number 86. What is the main complication of administering high concentrations of oxygen to patients with chronic obstructive pulmonary disease, COPD? A. Oxygen toxicity. B. Carbon dioxide retention. C. Increased risk of infection. Or D. Pulmonary hypertension. The answer is B. Carbon dioxide retention. Number 87. In the management of a patient with a massive pulmonary embolism, PE, what is the primary treatment goal? A. To improve oxygenation. B. To dissolve the clot. C. To prevent recurrent PE. Or D. To stabilize hemodynamics. The answer is D. To stabilize hemodynamics. Number 88. What is the primary concern in a patient with acute liver failure and coagulopathy? A. Risk of gastrointestinal bleed. B. Development of deep vein thrombosis. C. Risk of spontaneous bleeding. Or D. Hemodynamic instability. The answer is C. Risk of spontaneous bleeding. Number 89. In a patient with acute ischemic stroke, what is the primary benefit of administering tissue plasminogen activator, TPA? A. To reduce cerebral edema. B. To prevent a recurrent stroke. C. To dissolve the clot and restore blood flow. Or D. To lower intracranial pressure. The answer is C. To dissolve the clot and restore blood flow. Number 90. What is the most critical factor in the initial assessment of a burn patient? A. Determining the depth of the burn. B. Estimating the total body surface area, TBSA, affected. C. Identifying the causative agent of the burn. Or D. Assessing for associated inhalation injury. The answer is B. Estimating the total body surface area, TBSA, affected. Number 91. What is the primary reason for using diuretics in the management of acute heart failure? A. To increase cardiac output. B. To reduce preload and pulmonary congestion. C. To control heart rate. Or D. To improve myocardial contractility. The answer is B. To reduce preload and pulmonary congestion. Number 92. In managing a critically ill patient with hypernatremia, what is the most important treatment consideration? A. Rapid correction of sodium levels. B. Slow and controlled reduction of sodium. C. Immediate fluid restriction. Or D. Administration of sodium-free intravenous fluids. The answer is B. Slow and controlled reduction of sodium. Number 93. What is the primary goal of early enteral nutrition in critically ill patients? A. To prevent malnutrition. B. To enhance immune function. C. To promote gastrointestinal function, or D. To reduce the risk of infection? The answer is C. To promote gastrointestinal function. 94. In a patient with status epilepticus, what is the main goal of initial management? A. To control seizure activity. B. To prevent brain injury. C. To identify the cause of the seizures. Or D. To maintain airway patency. The answer is A. To control seizure activity. Number 95. What is the primary reason for monitoring arterial blood gases, ABGs, in a patient with acute respiratory failure? A. To assess oxygenation and ventilation. B. To determine fluid status. C. To monitor electrolyte levels. Or D. To evaluate renal function. The answer is A. To assess oxygenation and ventilation. 96. In a patient with acute renal failure, what is the significance of anuria? A. Indicates a prerenal cause. B. Suggests acute tubular necrosis. C. Implies chronic kidney disease. Or D. Indicates a need for immediate dialysis. The answer is B. Suggests acute tubular necrosis. Number 97. What is the primary indication for the use of invasive hemodynamic monitoring in a critically ill patient? A. To guide fluid and vasopressor therapy. B. To monitor for signs of infection. C. To evaluate cardiac function. Or D. To assess for pulmonary hypertension. The answer is A. To guide fluid and vasopressor therapy. 98. In a patient with a traumatic brain injury, what is the significance of a widening pulse pressure? A. Indicates hypovolemia. B. Suggests increased intracranial pressure. C. Implies bradycardia. Or D. Indicates a stable condition. The answer is B. Suggests increased intracranial pressure. Number 99. What is the primary treatment strategy for a patient with cardiogenic shock? A. Aggressive fluid resuscitation. B. High-dose diuretic therapy. C. Inotropic support and vasodilators. Or D. Immediate coronary revascularization. The answer is C. Inotropic support and vasodilators. Number 100. In managing a patient with acute respiratory distress syndrome, ARDS, what is the role of prone positioning? A. To improve ventilation, perfusion mismatch. B. To facilitate drainage of secretions. C. To reduce the need for sedation, to prevent ventilator-associated pneumonia. The answer is A. To improve ventilation, perfusion mismatch. Number 101. What is the most appropriate initial step in managing a patient with suspected acute upper gastrointestinal bleeding? A. Endoscopic evaluation. B. Administration of proton pump inhibitors. C. Blood transfusion. Or D. Gastric lavage. The answer is B. Administration of proton pump inhibitors. Number 102. In a patient with septic shock, what is the significance of decreasing serum lactate levels? A. Indicates worsening organ dysfunction. B. Suggests effective resuscitation and improved tissue perfusion. C. Implies an increased risk of mortality. Or D. Indicates the need for increased fluid administration. The answer is B. Suggests effective resuscitation and improved tissue perfusion. Number 103. What is the primary goal in the management of a patient with a pulmonary embolism? A. To dissolve the clot. B. To prevent reoccurrence. C. To stabilize hemodynamics and improve oxygenation. D. To initiate long-term anticoagulation. The answer is C. To stabilize hemodynamics and improve oxygenation. 104. In a critically ill patient with hypomagnesemia, what is the most common clinical manifestation? A. Hypertension. B. Tachycardia. C. Seizures. Or D. Muscle weakness. The answer is C. seizures. 105. What is the primary rationale for using beta blockers in a patient with acute myocardial infarction? A. To reduce myocardial oxygen demand. B. To control arrhythmias. C. To lower blood pressure. Or D. To prevent ventricular remodeling. The answer is A. To reduce myocardial oxygen demand. Number 106. In the management of a patient with acute pancreatitis, what is the significance of elevated serum amylase and lipase levels? A. Indicates biliary tract disease. B. Suggests pancreatic inflammation. C. Implies liver dysfunction. Or D. Indicates renal insufficiency. The answer is B. Suggests pancreatic inflammation. Number 107. What is the primary consideration when selecting a sedative agent for a mechanically ventilated patient? A. The cost of the medication. B. The duration of action. C. The patient's level of discomfort. Or D. The risk of respiratory depression. The answer is B. The duration of action. 108. In a patient with acute liver failure, what is the primary treatment for hepatic encephalopathy? A. Lactose administration. B. High-dose corticosteroids. C. Liver transplantation. Or D. Albumin infusion. The answer is A. Lactulose administration. Number 109. What is the primary goal of using neuromuscular blocking agents in critically ill patients? A. To reduce anxiety and agitation. B. To facilitate mechanical ventilation. C. To prevent muscle spasms. Or D. To treat chronic pain. The answer is B. To facilitate mechanical ventilation. Number 110. In a patient with a suspected lower gastrointestinal bleed, what is the initial diagnostic procedure? A. Colonoscopy. B. Abdominal ultrasound. C. CT angiography. Or D. Barium enema. The answer is A. Colonoscopy. Number 111. What is the primary clinical indicator of acute respiratory acidosis in a critically ill patient? A. Rapid shallow breathing. B. Decreased blood pH and increased PaCO2. C. Elevated blood pH and decreased PaCO2. Or D. Hypoxemia and hypercapnia. The answer is B. Decreased blood pH and increased PaCO2. Number 112. In a patient with acute kidney injury, AKI, what is the primary purpose of continuous renal replacement therapy, CRRT? A. To rapidly clear toxins from the blood. B. To manage fluid overload and electrolyte imbalances. C. To permanently replace kidney function. Or D. To stimulate renal recovery. The answer is B. To manage fluid overload and electrolyte imbalances. Number 113. What is the most effective initial management strategy for a patient with cardiogenic pulmonary edema? A. High-flow oxygen therapy. B. Aggressive fluid resuscitation. C. Immediate diuretic administration. Or D. Invasive mechanical ventilation. The answer is A. High-flow oxygen therapy. Number 114. In a patient with septic shock, what is the significance of a sustained high central venous pressure, CVP? A. Indicates hypovolemia. B. Suggests right ventricular dysfunction. C. Implies fluid responsiveness. D. Indicates left ventricular failure. The answer is B. Suggests right ventricular dysfunction. 115. What is the primary reason for administering corticosteroids in a patient with severe asthma exacerbation? A. To relieve airway obstruction. B. To reduce airway inflammation. C. To prevent respiratory failure. Or D. To increase bronchodilation. The answer is B. To reduce airway inflammation. 116. In the management of a patient with traumatic spinal cord injury, What is the main goal of high-dose corticosteroid therapy? A. To promote nerve regeneration. B. To reduce spinal cord edema. C. To control chronic pain. Or D. To prevent secondary infection. The answer is B. To reduce spinal cord edema. 117. What is the primary indication for the use of non-invasive positive pressure ventilation, NIPPV, in acute respiratory failure? A. To avoid endotracheal intubation. B. To deliver high concentrations of oxygen. C. To rest respiratory muscles. D. To correct severe hypoxemia. The answer is A. To avoid endotracheal intubation. 118. In a patient with acute liver failure, what is the primary purpose of administering fresh frozen plasma, FFP? A. To provide nutritional support. B. To correct coagulopathy. C. To increase plasma volume. Or D. To treat hemolysis. The answer is B. To correct coagulopathy. 119. What is the primary rationale for using inotropes in a patient with septic shock? A. To increase renal perfusion. To improve myocardial contractility. C. To reduce heart rate. D. To control blood pressure. The answer is B. To improve myocardial contractility. 120. In the management of a patient with severe burns, what is the primary goal of fluid resuscitation in the first 24 hours? A. To prevent hypovolemia and organ failure. B. To achieve diuresis. C. To reduce burn depth. D. To prevent infection. The answer is A. To prevent hypovolemia and organ failure. 121. What is the primary indication for performing an endotracheal intubation in a critically ill patient? A. To facilitate suctioning of secretions. B. To administer inhaled medication. C. To ensure airway protection and ventilation. D. To prevent aspiration pneumonia. The answer is C. To ensure airway protection and ventilation. 122. In a patient with a large hemispheric stroke, what is the primary concern related to increased intracranial pressure, ICP? A. Seizure. B. Hemorrhagic transformation. C. Brain herniation. D. Hydrocephalus. The answer is C. Brain herniation. 123. What is the most appropriate first-line treatment for a patient experiencing acute hypoglycemia in the ICU? A. Oral glucose administration. B. Intravenous dextrose infusion. C. Glucagon injection. D. Adjustment of insulin dose. The answer is B. Intravenous dextrose infusion. Number 124. In a critically ill patient, what is the primary significance of a low mixed venous oxygen saturation, SVO2? A. Indicates over-resuscitation. B. Suggests impaired tissue oxygenation. C. Implies hypermetabolic state. D. Indicates hyperventilation. The answer is B. Suggests impaired tissue oxygenation. Number 125. What is the primary goal of therapeutic hypothermia in a patient after cardiac arrest? A. To reduce fever. B. To decrease metabolic demand. C. To prevent infection. D. To improve cardiac function. The answer is B. To decrease metabolic demand. Number 126. In a patient with acute respiratory distress syndrome, ARDS, what is the significance of a high positive end expiratory pressure, PEEP? A. Indicates lung overdistension. B. Suggests the need for higher oxygen concentration. C. Aims to prevent alveolar collapse. Or D. Implies increased risk of barotrauma. The answer is C. Aims to prevent alveolar collapse. Number 127. What is the primary clinical manifestation of acute hypocalcemia in a critically ill patient? A. Muscle weakness. B. Hypotension, C. Tetany and muscle cramps, or D. Bradycardia? The answer is C. Tetany and muscle cramps. Number 128. In managing a patient with acute upper gastrointestinal bleeding, what is the primary purpose of endoscopic therapy? A. To provide nutritional support. B. To diagnose the source of bleeding. C. To control bleeding. Or D. To prevent rebleeding? The answer is C. To control bleeding. Number 129. What is the primary reason for the use of vasodilator therapy in a patient with acute decompensated heart failure? A. To increase urine output. B. To reduce preload and afterload. C. To improve cardiac contractility. D. To control heart rate. The answer is B. To reduce preload and afterload. Number 130. In the management of a critically ill patient with acute metabolic acidosis, what is the most appropriate initial intervention? A. Bicarbonate administration. B. Increased ventilatory support. C. Hemodialysis. D. Correction of the underlying cause. The answer is D. Correction of the underlying cause. What is the primary concern in a critically ill patient with a platelet count below 50,000 per microliter? A. Thrombosis. B. Hemorrhage. C. Infection. D. Anemia. The answer is B. Hemorrhage. Number 132. In the management of a patient with diabetic ketoacidosis, DKA, what is the primary purpose of insulin therapy? A. To correct hyperglycemia. B. To suppress ketone production. C. To increase urine output. Or D. To correct electrolyte imbalances. The answer is B. To suppress ketone production. 133. What is the primary indication for using a pulmonary artery catheter in a critically ill patient? A. To deliver medications directly to the lungs. B. To assess pulmonary artery pressure and cardiac output. C. To facilitate lung recruitment maneuvers. Or D. To monitor oxygenation status. The answer is B. To assess pulmonary artery pressure and cardiac output. Number 134. In a patient with acute respiratory distress syndrome, ARDS, what is the primary goal of using high positive end expiratory pressure, PEEP? A. To increase oxygen delivery. B. To reduce the need for sedation. C. To prevent alveolar collapse at end expiration. D. To facilitate weaning from mechanical ventilation. The answer is C. To prevent alveolar collapse at end expiration. Number 135. What is the primary goal of administering vasopressors to a patient in shock? A. To increase urine output. B. To decrease heart rate. C. To maintain adequate organ perfusion. D. To reduce vascular resistance. The answer is C. To maintain adequate organ perfusion. Number 136. In a critically ill patient, what is the most common cause of hypomagnesemia? A. Renal failure. B. Poor dietary intake. C. Diuretic therapy. Or D. Excessive gastrointestinal loss. The answer is C. Diuretic therapy. Number 137. What is the primary clinical manifestation of tension pneumothorax in a critically ill patient? A. Bradycardia. B. Hyperresonance to percussion on the affected side. C. Decreased breath sounds on the affected side. D. Bilateral wheezing. The answer is C. Decreased breath sounds on the affected side. Number 138. In managing a patient with septic shock, what is the primary goal of early antibiotic administration? A. To reduce fever. B. To control the source of infection. C. To prevent the spread of infection. Or D. To decrease inflammatory response. The answer is B. To control the source of infection. Number 139. What is the most significant risk associated with rapid correction of chronic hyponatremia in a critically ill patient? A. Pulmonary edema. B. Central pontine myelinolysis. C. Acute kidney injury. D. Seizures. The answer is B. Central pontine myelinolysis. Number 140. In a patient with a suspected myocardial infarction, what is the primary benefit of administering aspirin? A. To relieve chest pain. B. To reduce inflammation. C. To prevent clot formation. Or D. To control blood pressure. The answer is C. To prevent clot formation. 141. What is the primary reason for continuous electrocardiogram, ECG, monitoring in a critically ill patient? A. To detect arrhythmias. B. To monitor heart rate variability. C. To assess cardiac ischemia. D. To evaluate cardiac output. The answer is A. To detect arrhythmias. Number 142. In a patient with acute liver failure, what is the significance of elevated ammonia levels? A. Indicates renal dysfunction. B. Suggests gastrointestinal bleeding. C. Implies worsening liver function. Or D. Indicates respiratory failure. The answer is C. Implies worsening liver function. Number 143. What is the primary goal of using a beta blocker in a patient with acute aortic dissection? A. To reduce blood pressure. B. To decrease heart rate. C. To prevent rupture of the aorta. D. To control pain. The answer is B. To decrease heart rate. Number 144. In a critically ill patient with acute hypoxemic respiratory failure, what is the primary goal of oxygen therapy? A. To reduce the work of breathing. B. To correct hypoxemia. C. To prevent hypercapnia. D. To decrease the need for mechanical ventilation. The answer is B. To correct hypoxemia. Number 145. In a patient with acute decompensated heart failure, what is the significance of a third heart sound, S3? A. Indicates valvular dysfunction. B. Suggests left ventricular failure. C. Implies pericardial effusion. Or D. Indicates right ventricular hypertrophy. Answer is B. Suggests left ventricular failure. 146. What is the primary goal of using anticoagulant therapy in patients with arterial fibrillation? A. To control heart rate. B. To prevent thromboembolic events. C. To improve cardiac output. D. To convert to sinus rhythm. The answer is B. To prevent thromboembolic events. Number 147. In a critically ill patient with acute respiratory alkalosis, what is the most common cause? A. Hyperventilation due to anxiety or pain. B. Overuse of diuretics. C. Metabolic disturbances. Or D. Lung disease. The answer is A. Hyperventilation due to anxiety or pain. Number 148. What is the primary purpose of using a sedation scale in a mechanically ventilated patient? A. To ensure adequate sedation and comfort. B. To assess the patient's level of consciousness. C. To determine the need for neuromuscular blockade. Or D. To monitor for delirium. The answer is A. To ensure adequate sedation and comfort. Number 149. In the management of a patient with severe traumatic brain injury, what is the primary goal of maintaining normothermia? A. To reduce cerebral metabolism. B. To prevent infection. C. To facilitate wound healing. Or D. To reduce the risk of seizures. The answer is A. To reduce cerebral metabolism. Number 150. What is the primary indication for performing percutaneous coronary intervention, PCI, in a patient with acute myocardial infarction? A. To control chest pain. B. To restore coronary blood flow. C. To reduce the risk of stroke. Or D. To improve left ventricular function. The answer is B. To restore coronary blood flow.